Hello, my name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Sciences here at Boise State University. It's with great excitement that I introduce a new program in PT that is out of Washington State. I have Angela McCabe from Pacific Northwest University in Yakima Valley to share some information about this program. Go ahead and share your screen and take it away.
Wonderful. So thank you so much for having me. We're very excited to be partnering with our Northwest universities to offer this program to the Pacific Northwest students. That's the students that we're targeting. That's part of our mission. And so as I go through, if you have any questions, I'll at the end, there is some email information where you can reach out. So I will go ahead and share my screen. And there we go. Okay, so I have a short presentation on our program and then question and answers at the end, but happy to answer any questions at all. So our Doctor of Physical Therapy program is in the candidacy stage. So how CAPTE, our accrediting body, works is that a new program has to submit a lot of documents prior to achieving accreditation standing. We have gone through we're in the fourth stage. So we have submitted our application. We have submitted all of the required documentation. We went through a site visit where they came and interviewed faculty and looked at our faculties or our positions and our spaces. And we are now awaiting our candidacy status, which should come through any day. One thing to know about new programs is that you have candidacy status, which allows you to matriculate your first class, and full accreditation does not happen until that first class graduates. So the Department of Education has said that the CAPTE accreditation body needs to treat candidacy just like accreditation. So students that go through our program will be able to sit for boards regardless of accreditation status. So but we are fully confident that we are going to move through all the stages of this process successfully. So our program's in Yakima, Washington, which is kind of central East Washington. We need more physical therapists, specifically in the Pacific Northwest, and these are some of the reasons that we need them. Our population is growing. There is a workforce shortage. And so we are really looking to join the programs within the Pacific Northwest to really educate and train physical therapists that will hopefully stay in that region and help us to mitigate this shortage. So many of you that are interested in physical therapy may be thinking primarily about the outpatient environment. That may be your experience, right? Maybe perhaps you had an ACL tear when you were in high school in sports, and that's what kind of turned you on to physical therapy. The physical therapists work in a variety of settings. They work with all types of different patients. The really great thing as a health profession is that we get a lot of one-on-one time with our patients, and we can really help and see the efforts that we're putting into our patients to really see them pay off. And that's one thing I really love about being a physical therapist. Versus maybe a physician or a DO. And so we are movement experts, and we do a lot of hands-on work with our patients. We are trained in the basic sciences, kinesiology, anatomy, physiology, but we also have specialized training in cardiopulmonary aspects of care, for orthopedics, for pelvic health. There are all types of different specialties that our curriculum is designed to educate the physical therapist to be able to go out into the world and treat. So again, we also work with chronic diseases. Think about Parkinson's, right? That diagnosis of Parkinson's that may be devastating to that individual. We can really work with patients to help improve their quality of life, even though they have permanent disabilities or permanent diagnoses that will affect them throughout their entire life. Another aspect of physical therapy is, of course, the wellness. We have a great breadth and depth of information to help individuals on their journey for wellness and health. Salary, the median salary for PTs is $91,000, and that is partially dependent on where you live as well. In the Pacific Northwest, salaries are higher than, say, the East Coast. So how much you make partially depends on where you choose to practice. Because our program is dedicated to the rural mission, right? Rural and medically underserved. We want to help individuals become physical therapists that have really strong ability in rural healthcare. And the reason why that's so important is because as a rural physical therapist, you have to be able to treat anything that walks in the door. Right? So you may see a baby with torticollis first thing in the morning. You may have an 80-year-old with a hip fracture in midday. And at the end of the day, perhaps you're working with high school students that have had injuries, athletes. So it's really important that we create a well-rounded physical therapist more than a specialized physical therapist. So you kind of get all of those components in our program. It is a 3-year program over 8 semesters. 5 semesters are didactic, where you're in the classroom working with your peers. And then 3 semesters are full-time clinical education, where you're actually embedded into a physical therapy practice so that you can practice those skills. Another really unique thing about our program is that we have integrated learning experiences throughout the curriculum. So for instance, starting in semester 2, students are working in a homeless shelter with patients directly one-on-one with the supervision of clinical instructors, so that you can apply what you're learning immediately, because we know that's what really facilitates deep and enriched learning, is the ability to apply things immediately. And if you have to wait until the very end, till your clinical experiences, some of that gets lost. So we've integrated these clinical experiences where you're supervised, but you're working in different environments. In semester 2, it's a homeless shelter. In semester 4 and 5, it's a pro bono clinic, primarily looking at neurodiagnosis. And then again, back to the homeless shelter, as well as working within the community on wellness in the last semester before you go out on clinicals. So that's something unique about our program. And it looks like I am, there we go. So admissions requirements. So we require our students to have a bachelor's degree before they matriculate into the program. We have 10 prerequisite courses that I'll go over specifically for Boise, what our prerequisites are after this presentation. You may have 2 prerequisite courses outstanding when you come to interview. So it's not like you have to have everything buttoned up before you apply and have interviews, but you have to be kind of well on your way in these prerequisites. We do require the GRE. We don't have a minimum standard for GRE. We have no minimum standard for GPA either. We need 3 letters of recommendation, and we really want to see one from a physical therapist if possible. We know through the pandemic that there has been difficulties for students finding shadowing experiences because of that. And so we are not requiring it in this admission cycle. We're only recommending it. And so, of course, we want you to know what physical therapy is and have made that decision that that is your calling, and that's really where you want to be. Again, the prerequisite courses looking at human anatomy, we want lab involved with that. We want to see human physiology with lab, or there can be a combination of those 2 courses, anatomy and physiology. Many universities combine them into one course. And so that's fine, but we need 2 sequenced if it is a combination. Psychology is really important to our practice. As physical therapists, we are dealing with individuals that have gone through injury and illness, And having that background in psychology helps us to really help our patients better. Again, biology, general chemistry, and physics, all important to the study of physical therapy. So having this prerequisites helps you to come into our program with the prerequisite knowledge that really is strong and helps you to be successful in our program. Additionally, we're requiring medical terminology prior to matriculation. So you don't have to have that in your undergraduate degree, but prior to matriculation, we want to see you take a medical terminology course so that you come in again with that knowledge. We can help direct you to some online courses if you need help with that. So it's not easy to get into PT school. It is competitive. And so we encourage you to get an early start on thinking about your career as a physical therapist and getting ready to apply. So other things to look for is when you're looking at different programs, look for a fit. Look at their curriculum. Is that in line with what you want? So for example, our curriculum is really about the generalist, right? Being able to treat that baby or that geriatric patient throughout any system, right? Whether it's cardiopulmonary, whether it's musculoskeletal. And so look at the curriculum at the programs. And if that's not what you want, you don't want to be a generalist, you want to specialize in sports medicine and that's what's important to you, then look for programs that have that emphasis in their program and do that comparison. Again, observation hours may be required at different programs. For us, for our program at PNWU, we don't require observation hours, but we require an understanding of the profession. So you can get that in different ways. You don't have to shadow, but you can also get that through research. The American Physical Therapy Association has many different documents, many different videos to help you understand about the practice of physical therapy. So what are we looking for? When we're looking at our applicants, we're looking for a strong desire to work in rural or medically underserved communities. That is our mission. That is our focus. We want strong personal and professional attributes in that, some leadership abilities. So in your extracurricular time, do you have some leadership within that? Are you working with a rural or medically underserved population? Are you working, you're part of the Boy Scouts or the Girl Scouts or 4-H, anything like that. We're looking for diverse experience and exposure, strong written and oral communication skills. We are looking for that candidate that has service and altruism kind of built into them, right? Are you volunteering within your community? Do you volunteer at the food bank? Do you volunteer for tutoring other students at your university? We also want to look in our applicants that they've spent time looking at our website and they know about the program. Obviously, dedication to the profession, and then again, those leadership skills. So we are mission driven, our rural emphasis, and movement science is our basis for our curriculum. We have expert clinicians and researchers available as faculty to teach our students. Our cornerstones are in interprofessional education and community service. So like I said, having students work in the homeless shelter under supervision. We're dedicating time to our community. Interprofessional education is all about working with our peers in healthcare, right? Our physicians, our social workers, our occupational therapists, colleagues. And we really have an emphasis to teach our students how to do that. So you're not working in your silo, that you know how to reach out to other professions, you know about other professions, so you can give the very best care to your patients. We have that hands-on learning that we talked about. Our full-time clinicals are a total of 34 weeks over 3 different experiences. For anatomy, we do cadaver dissection, and that is a class that's taught in conjunction with Doctor of Osteopathy students, so you'll get to meet your peers there. We have state-of-the-art facilities. This building that we are housed in is brand new. It's a year old. It was designed with physical therapy program in mind. Additionally, future buildings by the fall of 2023 There will be a student learning center that will have a significant amount, 46,000 square feet of simulation space to allow our students to experience what does the hospital environment look like and feel like? What does it feel like for me to practice in that? So we'll be integrating our students into that simulation center for that real experience. It's a safe learning environment so that it's okay to make mistakes. It's okay to learn from our mistakes in that environment. And so that's going to be an important part of the curriculum as well. It is 100% in person, so you do need to live in Yakima or the surrounding areas. You will be attending in class with your peers. There are a few courses that will be taught virtually through Zoom, but not every course has been designated as that. So it might be in person, it might be not. So we are dedicated to research. We want our profession to continue to grow. And so through the capstone project that all students are required to do, research is one arm of that. So you can be involved in research studies of faculty. Additionally, small class size. We only have a class size of 50 in our cohort. So I want to play a video for you. And I am going to also drop the link into the chat, so you'll be able to do this. But let's give this a go and see if you can hear this. And Erin, if you could just give me a thumbs up if it's okay. I'm going to play it within the video, and then if that doesn't work, I'll kind of make the shift to YouTube. Zoom's a little weird about content of videos sometimes.
I volunteer at Union Gospel Mission Free Clinic. They're a free clinic that offers healthcare to anyone regardless of whether or not they have insurance or whether or not they can pay. The other day I was there and this woman, she had a shoulder injury, and so she kind of stopped using it. It had been like a year that this injury had been going on, and she hadn't really had access to any kind of medical care. She wasn't able to get surgery, she wasn't able to get physical therapy, and so her shoulder had kind of frozen.
The primary cares are really overwhelmed around here. So sometimes patients will call and like the doc's schedules are like fully booked for, the next 2 weeks, but they're having this abdominal pain. Those patients that kind of fall through the cracks come to the ER. And sometimes they're people that, they haven't had routine exams in several years, and now they're super sick, or they're having all these different kind of organ failures going on, or diseases that have gone undetected or unscreened just because they either haven't been able to get into their physician, or lack of funds, lack of insurance, that kind of thing.
I got diagnosed with cancer, and it kind of really made me think, like, have you really asked somebody to like save my life, or else I was gonna die. I was supposed to go down to the University of Utah, but they refused me because of insurance. So basically one of my friend's dads ended up doing the surgery because he was the most experienced person in the area. Even with or without insurance, I mean, there was nobody in the town that really was a cancer specialist, knew how to treat my cancer. Nobody really knew how to do it. I mean, you need specialists that only major cities have, and they're few and far between, especially out in the Northwest.
It is realistic to see other specialists that are far away. I think that's a lot of cases we have to travel out of town to do that. But to have someone there that's close to home, that's able to say, let's make a phone call to a certain specialty, and I'm going to be beside you this whole time. I want to be, my office, my staff are here for you. And I think that's something that was missing when we, growing up.
My husband, he's got diverticulitis. He had a flare-up last year and had to go to the emergency room because this clinic didn't have anything open. All the doctors were filled up.
Running a business is real challenging in a small town, but it was what my dad could not relocate. And that's the case for a lot of people. It's like their families can't just get up and go if their son has diabetes. Their livelihood is depending on the family's business or what's keeping them in that small town.
I think all of us in the field are pretty painfully aware that there's a huge shortage of physicians, and there are a lot of physicians in the baby boomer generation that are retiring, and the retirement rate is higher than the rate that we're actually matriculating physicians.
The concept of developing a medical school that would be able to help this community and this region create a new generation, and then maybe many generations of physicians to take care of our health needs, was just a tremendous motivation.
The mission statement really resonated with me in terms of training physicians to serve in rural and underserved areas. That's why I really wanted to go into medicine in the first place, was to be a provider that provides medical services to people who wouldn't otherwise have access.
Whatever I can take and learn from here to be able to bring back into those small towns, small communities, be able to apply it, and that can be the difference maker in somebody's life.
What PNWU is doing is training physicians in such a way that majors on the reasons why we need to take the time. We need to listen to get to the root cause so that our communities are actually getting more healthy.
When people are healthy, they can more positively contribute to their communities.
When we founded the university, we founded a university, not just a college of osteopathic medicine.
We need everything we can possibly bring here in the medical field. There's a shortage in almost every direction you look.
Every program that you can bring in here, every possible future healthcare worker is going to be beneficial for the area. Everybody has such a crucial role, especially in rural healthcare.
That's what I see the additions to the campus doing, is creating that whole medical team model. That's really truly a whole patient model.
In a lot of small towns, especially in the Northwest, that are between cities that, yeah, there are a couple hundred people live there, but those people matter. And we need people to go take care of them.
We never dreamed that in our lifetime we would get the opportunity to help with something this big, this important. I mean, who could imagine that? And to think that we actually got to play a role in getting this thing here is the most satisfying thing in our life. So this campus is just at the beginning. 20 years from now, I predict there'll be multiple schools of training on this campus, most of them medical and medically oriented, and I love it. I'm proud of it. I'm proud of this community.
Oh, not doing it again. All right. So, there we go. Here's some resources that are available to you to learn more about not only our program and our school, but also the profession. So the PNWU started out as a DO program, and we now have nursing is there, through partnerships with other and collaborations with other universities. We have a medical arts master program. PT is coming on board the fall of 2022. OT is coming on the fall of 2023. We are pursuing a dental program as well. So this campus is just going to continue to grow. And in that video, you only saw the DO building, or the main building of campus. So we've built our building on the other side of that grassy area. And it's just going to continue to expand as we add more healthcare providers, educational schools to the university. So for any questions, Dr. Peggy Trueblood is our founding director. That is her cell phone, and you can call her or text her. And that is her email. Feel free to email out to her. She loves to hear from students. I think, sometimes students shy away because she's the program director, but I would encourage you to reach out to her. She loves students. She's been doing this a really long time. She's been program director for 20 years, and so we're very fortunate to have her. So just briefly, I want to show with you the alignment with Boise State and our prerequisites. I emailed this out to Ms. Colburn, so she has this and would be happy to provide it to you. And with that, I'll stop sharing. And I look forward to answering any questions that you need. I can put that in the chat. I will put that link to a case for PNWU. Again, that was made for DO recruiting, but I think it's very pertinent to physical therapy as well. You got to see some of the facilities that we have for our DO students. Ours are comparable, right? We're not a second-class citizen at this university, I guarantee you. My contact information, I'm going to type it into the chat, and I encourage you to reach out to either myself or Dr. Trueblood if you have any questions. Explore our website. There's a lot of information on that about our program. And I wish you guys every success in your career as a physical therapist. So thank you very much.
Well, I have a couple of questions. So could you share a little bit about what it's like to live in Yakima Valley?
Sure. So Yakima is a very rural city. It's surrounded by agriculture. So we have, they're growing all types of vegetables, all types of fruits, apples, and there's orchards and orchards. It's very green in the summer. Hops are another great crop that happen there. So it has a small town feel. We have a major hospital there with all the normal kinds of things that happen in a hospital in terms of outpatient clinics. There's outpatient physical therapy, there's a wound care clinic, there's a diabetes clinic. There's all types of healthcare there. Mostly our students live in either rentals, home rentals in groups and or apartments. There are apartment complexes that are within walking distance of the university. It's a typical small town. It's got a river that runs through it that's beautiful with walking and biking trails. So there's lots to do there. The mountains are just a short drive away. There's a ski resort within an hour. We're 2.5 hours from Seattle. So while we are rural, we're not totally isolated. There is an airport in Yakima as well.
Very cool. Would you say with the growth of the PT program, do you guys have some ideas where your clinical rotations will be located? Will you be branching out further than just the state of Washington?
Yes, great question. So CAPTE, our accreditation body, requires us to have 150 placements for students, like agreements in place, contracts in place prior to giving us candidacy. So we have all of those already established. They're all over the Pacific Northwest. So Idaho, Washington, Montana, California, it's kind of centered right now in the West. However, if students my grandma lives in Missouri in this town, right? And I'd really like to go do my clinical there and live with my grandma during that time to help save money, right? And so all you need to do is work with our ClinEd director, that's Amanda Adamson, and she will reach out to different physical therapy entities in that community and see about getting a placement for you. So while we are kind of centered in that Pacific Northwest, Oregon is another one, Idaho, Oregon, we have the ability to send students anywhere in the country. We haven't broached international yet, but that is something that I've done in my previous life at a previous institution, because we've sent students to Australia, New Zealand, all over the world. So I anticipate as we grow, that will happen as well. But for right now, it's Pacific Northwest with the ability to do other areas as students need.
Do you discourage or encourage individuals to work while in your program?
So we discourage students from working. We're at a 19 credit load per semester. It is a very rigorous program. And so we discourage students from working. Yeah.
Shannon, do you have any other questions for Angela?
I don't think I do. So I know you said, oh, just a little bit of a curiosity. So I know you said that with like the hours, the patient observation hours and stuff like that, it's hard with COVID. And so you guys have kind of eliminated that one, but I'm just wondering, for the students that are doing that, what have you seen?
So in general, most schools require 150 hours of observation. It depends on the school. And so I think for me, that's a great way to learn about the profession, right? So if students go and they shadow a physical therapist in an outpatient clinic, they might shadow a physical therapist in a hospital environment. So they're kind of getting the breadth and depth of the physical therapy profession. And so that's really the reason to do it, to help you to come to a decision of, yes, I want to be a PT. So my journey to become a PT, just really briefly, I all the way through high school thought I wanted to be a physician. And in my senior year, I had enough of my coursework done that I was allowed to take this specialized independent study where I went and shadowed some different physicians in their offices, right? A generalists, surgeons, all kinds of things. So what I saw was that physicians, they're healing, right? And they have a lot of things at their fingertips to help patients, but they don't spend much time with patients, right? It's pretty brief. And so when I was in the sports medicine clinic with an orthopedic surgeon, he had physical therapy in his back office. It was pre-days where we didn't do that, or we did that, right? So I went and spent time with the physical therapist back there, and I loved it, right? They got to like learn about their grandchildren and really help them through their illness, their injury. And you really got to see the effect of your hands, of your knowledge, of your skills in that patient. And so for me, that flipped a switch for me. And physical therapy was the way I was going. So I think that's the benefit of shadowing. It really helps to solidify what you want to do for a living. Prior to like getting into a program and you're in it and you go, oh, this isn't for me. I don't want to do this, right? So that's what shadowing does from my perspective.
In the coming years, as we hopefully get into a more state of being where maybe COVID isn't such a vibrant part of our lives, and maybe more doors open to students to be able to gain some of those experiences, do you foresee your program including those as expectations that they might require?
That's a great question. And I can say I don't know. So one of the part of our mission too is also to create diversity, right, within our profession. I think we absolutely know that our profession is a very white profession. And sometimes disadvantaged groups have difficulties getting those shadowing hours, right? Those 150 hours, that's a lot of free time you're giving away. And you maybe need to work to help support your family, or you need to work to help support yourself in school. And so there's been a lot of discussion about trying to remove as many of those barriers as we can to help increase the diversity of our class. we really want a diverse class. We want it to be representative of our community, right? So our community in Yakima is 52% Hispanic, right? So we want to remove as many barriers as we can to bring diversity into our program as well as into our profession. And that's really important to us. And so I don't know that post-pandemic, we're going to require those shadowing hours. We're going to see how these classes do, see how many students get into our program and go, oh my gosh, it's not what I bargained for, and how many exit. Without this requirement, we're going to kind of monitor that pretty closely and then make decisions based on data.
Anything else, Shannon? I don't want to be the only talker. Usually I ask questions like board examinations and things like that, rates and some of those things, but where you're a new program, I think that those aren't really relevant for you just yet. And I may have missed it, and it's just, there's a lot going on today, so I apologize. My husband got waylaid on his flight, so he was like panicked a bit, so I had to stop for a second and take care of that. But are you interviewing your applicants? Is that a part of your process? And could you talk a little bit about the interview process?
That is a great question. Thank you for bringing that up. So our application process is in PTCAS, and all programs use PTCAS as that. And so we have interview questions. There's an essay that you have to do. You have to submit your transcripts, and kind of, that's no different for any school. Once we go through and look at prerequisites and make sure our students have the prerequisites, the next step is to be invited to an interview. And we are doing virtual interviews, partially because of the pandemic, but partially also because we want to increase availability to our program, right? We want travel to Yakima to not be a barrier to come for an interview. Well, we'd love for students to come and see our space and see our equipment, and help that, and help that to be part of their decision making. We're doing virtual interviews. And so we're in the process right now of establishing, are we doing groups or one-on-one? And part of that is going to depend on our applicant load, right? Many programs have 1,000 applicants for their seats, lots. And so they have to be efficient, and they have to do group interviews. For us, just starting out, we may have the opportunity to do some one-on-one stuff, and we're really looking forward to that, right? To be able to really connect with the applicants so that not only we get to learn them, but for them to get to learn about us, right? As people, as faculty, as program, we want to create that relationship at the very beginning. And so we are waiting till we kind of see what our load is. We're going to have interviews on February 12th for students that apply before December 1, and March 19th. These are both Saturdays. And again, they're virtual for students that apply after December 1st, but before the PTCAS deadline. So that's kind of where we are right now in the process. So I don't have a firm answer for you, but it's going to partially depend on our applicant pool.
Cool. So kind of what you're sharing with me is that December 1st is kind of not your soft deadline that you're hoping to kind of get rolling on your rolling admissions with, and then you'll have that later date for anybody else. So
exactly. And we understand that students have many choices, right? There are many DPT programs, and they have to figure out the great fit, but then they also have to interview and be accepted. And so there may be lots of great students out there that don't get in to their goal university, right? But they really want, they know they want to be a PT, and they know they want to start this year, and they don't want to wait. And so they'll be expanding their search. So many DPT programs interview in the fall, very early spring, like January. And we understand that we may be getting some applicants later on because maybe they didn't get into their first choice. And that's okay. We understand we're a new program. We're, you know, and there may be some hesitancy in that. They don't know us. We don't have proven track records like many schools. I will say that our faculty, the experienced faculty, come from programs with 100% board passage rates, right? That's, my university had 100% first time board passage rate. So I know what it takes for students to get through their boards, right? So in terms of the curriculum, and I'm the curriculum director for the program. So we've laid out the curriculum based on the knowledge that faculty have about best practices and how to strengthen students' abilities to pass that board exam on their first try.
I'm gonna stop the recording.
Thank you.